Dr. Arani, you are the current president-elect of the board, and you are the immediate past president of the Nord, and you are a well-known, internationally known researcher and specialist in photobiomodulation, and you are a dentist.
Yep.
Yes. Could we maybe talk today about cancer safety?
Sure.
That has been a special topic here on WALS 2018. The big question is, and has always been, is there a risk for photobiomodulation to promote cancer progress?
Right. So,
Something about this.
absolutely. So, photobiomodulation is the use of low-dose light to stimulate biology. We use it very commonly in oral mucositis. These are cancer patients who are being treated for radiation or chemotherapy or for bone marrow transplants. The question has been, like you just correctly pointed out, that when you're stimulating healing, are you potentially stimulating tumor cells? And the answer to that question, as far as we can tell, with both laboratory experiments and with clinical studies, is that it does not stimulate cancer cells. We have evidence also that it is not capable of causing cancer, because we have always had some concern whether there are pre-transformed or pre-cancer cells in the tissues in these patients who have cancers. Can we promote that with light treatments? And the answer is no, we cannot. And there is conclusive basic science studies as well as preliminary clinical studies that have shown that you cannot promote cancers, nor can you transform tissues to start cancers.
And could you say something about, could then PBM impact negatively tumor growth or tumor proliferation, which is more or less the same question, but...
So, right, it is an interesting question. So if it doesn't harm tumors, can it actually help tumors? And the preliminary, and this is new research, that was some exciting parts were presented at this very meeting. Our group has also been doing a lot of research in this space. It turns out that the cancer cell is wired differently. It has different metabolic capabilities, it proliferates in an uncontrolled manner, it has different redox status, ROS, redox status. So when you shine therapeutic light on a normal cell, it behaves in a good way by either migrating or proliferating. When you do that with cancer cell, it tends to cause them to commit suicide.
Because it's strengthening the ATP, and ADP is necessary in order for apoptosis.
Right. So apoptosis is one cell death mechanism. The other one is autophagy. So both apoptosis and autophagy in cancerous cells can be stimulated by light treatment.
So in the cancer cell, it has a negative effect for the cancer cell, and in the normal cell, it promotes normal, healthy process.
Correct. Absolutely correct. There is also an effect on the host immune response. So normally our body fights cancers actively via the immune response, immune cells. There is actually the Nobel Prize this year was actually given for one of the immune therapies. Turns out that light treatment is capable of stimulating the host response against the tumor. And that has shown in preliminary studies to be capable of reducing the tumor burden.
That's fantastic. And you would also say there's no risk for PBM of local invasion or metastasis? No.
Right. So again, this goes back to the question that tumor cells are wired differently.
Yeah.
So when you shine light on normal healthy cells and you want to close a wound, they tend to migrate towards each other. But if you do the same thing to a tumor cell, the concern is that you would increase the infiltration. But this is not the case. So all the evidence right now suggests that these cells will respond very differently. We have to do definitive trials, clinical research, but the basic science lab experiments have shown that it is a differential response and you cannot promote infiltration.
Okay. And what about the response to tumor treatment?
So there is There is already certain treatments with near-infrared light which will increase the perfusion of tumors. This is not photobiomodulation treatment, but it also uses near-infrared, which is why it gets confused with photobiomodulation. It has shown that if you do the increased heating of the tumor, the vessels will dilate and you can get more chemotherapeutic drugs inside, which will kill the tumor more effectively. Now that is a separate treatment than photobiomodulation, and as I just alluded to, the photobiomodulation response is more the host immune response that attacks the tumor. So it has been shown to be synergistic with certain forms of chemo or radiation, and there is exciting new research with immunotherapies.
Assisting the immunotherapy.
Correct.
That's incredible.
So there is a lot of new research with combining photobiomodulation with immunotherapies, and the data looks very promising.
And one more thing is it possible that the local application of PBM could have effects also distant from the targeted site?
Yeah, we call it the episcopal effect or the bystander effect. It has been well shown that if you do a treatment at a particular area, you activate not only systemic factors that can diffuse, but you also activate the local healing response, which the body will react to. So both a locally diffusing response as well as a body response to a local change.
Okay.
Both of these have been shown with photobiomodulation treatment.
That's incredible. What would you say, what are the most efficient and safe parameters for PBM in order to get all these fantastic effects you
So the major purpose of this meeting is to try and come to that very answer. So
aren't any yet.
there are in 9 different areas. So we have identified 9 areas, and those are your consensus sessions and the main sessions here. They were planned in a way to bring the experts all around the world to chair those sessions and have a discussion. The point of this meeting is to identify and hopefully gain consensus in those 9 areas where the evidence is very, very strong. There are 5 clinical areas where there are multiple randomized clinical trials, and mucositis is the primary one. There was also a launch of a dry AMD device at the meeting. The other area have been with wound healing and certain kinds of stem cells for regenerative medicine. All these are areas for neurorehabilitation, for traumatic brain injuries, Parkinson's, and Alzheimer's disease. Now, how can light do all of this? We get asked that question all the time. And we are moving in the field towards thinking of light as a drug, a photoceutical, which means that as a drug, we have to be very careful about how much we dose the patient, how do we deliver that dose, and what is the response you're looking for. You would not use a painkiller for treating cancer or for hypertension, right? Similarly, the right wavelength of light with the right dose, delivered in a very particular way, in a very given protocol, is capable of doing all these responses. And that is the major goal of this meeting, is to try and develop consensus from world experts. I'm sure you've interviewed others who are world experts in this area.
Maybe we can talk also about your special field of research, which is, as I'm informed, stem cell therapy for dentistry. And this sounds so incredibly fantastic and future-like,
right.
But it's reality.
It is. So what people, and unfortunately what people think about when they think about stem cells is all the detrimental effects and the ethical concerns of embryonic stem cells. What a lot of the people don't realize, many people have not realized, is that, or appreciate, is that our body has a lot of endogenous resident stem cells, the most common being the bone marrow. But almost every tissue in your body, whether it's muscle, whether it's the eye, whether it's the brain or the heart, have stem cells in them that can actually be promoted to heal the tissue. Our area of interest is in the tooth, and there are dental stem cells that are present throughout your life inside the pulp of your tooth, which is the core of your teeth. So we have developed a technique where, using photobiomodulation, we can get the dental stem cells to form dentine. And this technique can potentially prevent root canal treatments.
So when can we expect that to, reach the clinical portals, the research labs?
So we have done these studies in the lab where we have actually shown a mechanism So why would we want to know mechanism? I just talked about how you can use different types of light, different doses, and get different responses. So just using light without understanding the mechanism is like shooting in the dark. So literally. So photobiomodulation for dental stem cells involves the activation of a very specific growth factor, TGF-beta. And we have done experiments in animals to confirm that you can actually form dentine in a very controlled manner. We have also shown that we have specific biomarkers. The amount of light dose that I would need versus another person who comes into my clinic would need are very different. So we have developed biomarkers, both clinical and molecular, that can help us individualize treatment and make sure that we can ensure that we get a robust, reproducible clinical outcome. We have done all that work, it's all published, and we are poised to begin human clinical studies. So once we validate this in a large randomized clinical study, blinded, we would be able to offer this as a treatment to every patient.
What else?
So I can give you a plug for WALT. So the World Association for Laser Therapy, as it's known, is going to be renamed as of tomorrow into World Association of Photobiomodulation Therapy. So we believe that the term photobiomodulation is more appropriate because it is well understood that lasers, LEDs, and other light sources can be used for this treatment. So I think it's an appropriate change of the time, and there are good publications supporting this use of this term. We also like the term photobiomodulation because if you use the right dose, you can reduce pain and inflammation, which are detrimental reactions. Or if you use a different dose, you can promote positive processes such as wound healing and tissue regeneration. So the term photobiomodulation is more scientifically accurate and is a mesh term in the PubMed, a medical subject head term. So the literature is coming together. The organization is very enthusiastic. This is one of the biggest photobiomodulation meetings to date. We had to stop registrations at 350, so we have a tremendous response. And as you can see from all the topics that are being covered, the scope.
So you would say the factor laser, which means the factor coherence, current light is getting in the background, or? Not
necessarily. So we have run these experiments. So we have compared a laser to an LED. And once the photon enters the tissue, you lose coherence anyways.
Yes.
So can you do a better job with lasers? In cell culture experiments, the answer is yes. The laser is much more efficient at evoking a biological response compared to an LED. But in a clinical context, the safety with a laser is narrower because you can cause damage very quickly.
Well, not with a 3D laser.
If you use it long enough and incorrectly, and if you have the wrong...
If you overdose.
Sure.
Yes.
So the potential detrimental effects, the therapeutic window is narrower in a laser compared to an LED.
Yeah.
You do mention a 3B laser or a specific class of a PBM laser. But as you are aware, there are other surgical lasers that are being turned down and they can be used for photobiomodulation. That's potentially very dangerous.
Of course.
And then there are the class 4 lasers. So,
which are also potentially very dangerous.
So everything is potentially dangerous, from water to air in the wrong place at the wrong time.
It's always
is dangerous.
Question of dose, right?
It's a question of understanding what are you trying to evoke. So light is very easy to use, but is very complex in terms of the biology and the physics behind it. So I think the field is maturing towards using the right dose at the right time. And we like the term photoceutical because we're thinking of light as a drug. And that helps us do a lot of elegant, well-designed experiments.
Fantastic.
Any other statistics?
So I think WALT is the world organization, and we are looking to collaborate with all organizations globally. And one of the big agendas as we move forward, given the tremendous interest, is to try and recruit other organizations that are interested. If you see the amount of human health benefits that this treatment can bring, irrespective of where you are, but especially in a resource-poor clinical practice, developing countries, I think this treatment can revolutionize healthcare. The interest is rising even in the developed countries, and you will probably hear about this. There is very strong interest from the policymakers and the big companies. So both of them usually are decision makers in what gets into the clinical market mainstream. And both of the, I guess, the overarching policy deciders or policy makers are looking at this treatment very carefully for its potential to revolutionize human healthcare. So you're going to hear a lot more about it, and it's a very exciting time.
We are sure about it.
It's a very exciting time.
Last interview now.
Absolutely.
Okay, doctor.
Great.
Thank you very much.
Absolutely. Thank you.